Good afternoon. Welcome everybody to this edition of Black Health Trust. I had a number of patients that I saw this week that made me want to rerun a previous program that we'd had before. And I know that many of us, self-included, do not do what is necessary to take care of yourself. I'm especially concerned that the health of our seniors is more compromised if I don't do what we're supposed to do. So our program today is about the health care of seniors. There's a young lady, well, middle-aged lady I saw in the office a few days ago. She had a history of lupus. She had congestive heart failure. And what I couldn't understand is that she smoked 5 packs of cigarettes per day.
Wow.
At the hand, I don't understand that. And she said she had recently cut down to only 3 packs of cigarettes per day. In addition, she had COPD, asthma, chronic cough, and pain in her joints from her lupus and God knows what. And also, she had been concerned that she wasn't being well served by the physicians that she had gone to. So we're going to present a program today. Dr. Adrienne Burrows, who is an internist, a graduate of Howard University. She's the director of multiple federally qualified health centers, and she specializes in the treatment of older individuals. Let's go with her presentation, Simon.
Introduction.
Go ahead go show her. I want to see her picture. And then you can go to her slides after that.
Thank you, and I'll start there. So I always put this character on the screen. I don't know if you guys are seeing, it should be a picture of a cartoon character, Buzz Lightyear from the Toy Story franchise.
Yes.
You may see the picture soon, but for any of you that had kids or grandkids or just felt like a kid, in the past couple of decades, maybe you have seen some of the Toy Story movies. And this character was the ever optimistic, looking on the bright side, superhero Buzz Lightyear. And his catchphrase, that he would say over and over again is to infinity and beyond. And I use that quite often in my own practice when I'm dealing with my patients, in particular my seniors, and they want to, ask, well, how long am I going to be around, doc? Or how healthy can you make me? And I want to inspire in them that I want them to be around to infinity and beyond. Next slide. And that's just a picture of me. We can go on to the next slide. Okay. Now, also for some of you that are older than 10 years old, you may recognize this gentleman, Mr. Dick, the late Dick Clark. And I put his picture up here because I grew up every year, and I still do, it's sort of almost in honor of him, and watching the ball drop on New Year's Eve. But New Year's Eve was synonymous with watching the Dick Clark Rockin' Eve show. And one of the things my family and most people I know always reveled over was, my gosh, does this guy ever age? I mean, you know, he went from American Bandstand and New Year, I mean, just year after year after year after year, you know, he seemed to have the vigor and the spirit and even the looks that just were timeless and ageless. So I always think of Mr. Dick Clark, and you know, and he was doing this probably without some of the augmentation options that we have today. We're going to the next slide. So how do we do this in the new millennium? Well, let's talk a little bit about aging in the 21st century. And this is a wonderfully dynamic time and period for medicine, for what we call aesthetics or integrative or regenerative, or, you know, all of these things coalesce at this period in time in a wonderfully magical and symbiotic way. So let's go on to the next slide. Okay, so let's start off with when we're talking to patients or clients, depending on how you like to refer to the individual or yourself, we talk about that nowadays there's a healthcare team. Once upon a time, there used to be an old show, Dr. Marcus Welby, where he was kind of the doctor and he told the patient what to do, and the patient listened yes or no, and you know, and it was sort of this paternalistic relationship. These days, the patient or the client and their provider are all part of a healthcare team. You know, and that team, of course, has the captain, which, if it's pertaining to you, the patient, you know, that is you. You know, you're in charge. You're in charge of your destiny. You're in charge of the options that are available to you and whether you utilize them or not. But you are an integral part of that team, and your participation is vital. Now, it gets very confusing in these days because with HMOs and managed care and different types of insurance and covered California and gosh knows the on and on myriad descriptions of how we attain our health care, it gets confusing. Well, what are the roles of all these different persons? So we already identified that the patient is the captain. That's the person that is in charge. And I recommend, of course, I may be a little bit biased being a primary care physician, which is abbreviated PCP, but I think we're also an important part of that team too. Not as important as the patient, but pretty important. So I'll call us the quarterback. Okay. So now a lot of people sometimes, even in my own family, sort of try to bypass the quarterback position because they feel like, well, that's just one extra person I got to go to. I can call my cardiologist. I can call my, you know, my heart surgeon and stuff. But it's important to have a person that's kind of the owner or the one that can kind of encapsulate all of these different things for you, that can help these things interconnect, because your specialists, well, they're very busy and they're also looking at things many times from their point of view as opposed to the holistic point of view. So having a primary care physician, which is what we are called these days, not to be confused with once upon a time, people might have said, oh, I have my general practitioner or my GP, is typically something that you want to have as part of your team and that you, the captain, want to have a close relationship with. Now, the other key players on your team, those are all the persons, you know, if this is a game, whatever your sport is, that is important in helping you reach that goal. So that may be other specialists, that may be your family, that may be your neighbor, that may be your pharmacist. You know, there's a infinite number of persons that can be part of your team at any given period of time. Next slide. Okay, so I believe we also have on the call a wonderful Dr. Jesse Sherrod, and many years ago I felt like we pioneered, you know, touting this to the public, letting them know this catchphrase, know your numbers. Okay, and what does that mean? That means that as part of your healthcare team, unfortunately or fortunately, there comes a little bit of responsibility. So some of the things that a patient, any person, if within their wherewithal, should try to know and remember are at the very minimum these three things. Something called your BMI, which is your basic or basal metabolic index. And that's a calculation that sort of plugs in your height and your weight and gives us a number that, by which your medical providers can communicate, you know, the status of your weight as healthy or unhealthy, obese, overweight, or non-obese in an objective manner. So it's not about how good we think you look, or we think you look chubby, or we think you look skinny. We can all talk in terms of BMI and know that we're talking about the same things. Now, the next thing is your hemoglobin A1C. You may see it on commercials, or, it's important to just remember the last three parts, which is A1C. Do you know your A1C? That first word, hemoglobin, is not to be confused with hemoglobin as in your blood count. The hemoglobin A1C is what pertains to your blood sugar, and it is a more accurate description of whether or not a person actually has diabetes or is pre-diabetic than checking your blood sugar or your glucose at any one moment in time. Your hemoglobin A1C is reflective of the average of your glucose over 3 months. So you can't cheat before you go to the doctor. You can't eat a salad the day before and say I have good numbers, or you can't blame it on the donut you ate night before last. The hemoglobin A1C really lets us know the truth about how your blood sugars are doing in your body. And just so that you know, we want your hemoglobin A1C to be less than 5.7. Okay. And then your cholesterol. Now, cholesterol can be a little bit tricky because there's several values that are reported in cholesterol. And depending on the doctor that you're going to, they may check certain types of panels that list some or all or different aspects of the cholesterol. So it can be sometimes challenging to communicate your cholesterol from person to person. But at the very least, you might want to know what your total cholesterol is, what your LDL, low density lipoprotein, also known as your bad cholesterol, and something called your cholesterol ratio. Now, a question patients may ask me is, well, what is bad cholesterol? And unfortunately, I like to say, well, you know it when you have it because it's delicious, right? So if it's yummy, if it's oily, if it's making you go, that's so delicious, like those fries and that pizza and that ice cream, yeah, that's probably the bad cholesterol. So you don't have to think too hard about it because it's usually putting a smile on your face. All righty. So we just want to make sure that we know those numbers so that we can always be cognizant of how to modify and optimize those numbers. And just so for the record, we want your total cholesterol to be approximately less than 200 in most persons. We want your LDL to be approximately less than 100 in most persons. And cholesterol ratio, there's a couple of different types, and it's specific to your sex and your age. So that may vary depending from person to person, but usually 3.2 is a good number, is a good basic number. Okay, next slide, please. All righty. Still talking about this captain, this member of the healthcare team, some of the other responsibilities that would go very far for you, whether we like it or not. And that is, you still want to get those regular annual examinations. Everyone goes to Google and we can look up how we feel. And believe it or not, I go to Google myself, but nothing is going to replace you, the captain, meeting with your doctors, particularly your primary care doctor, at least once a year. And when you go, us doctors would love, love, love if you know what medications you're taking. So you can bring in a list of your medications, or what I even like in my office is, hey, just throw them all in a bag. Just go to your medicine cabinet and just for that one day, throw them all in a grocery bag and bring them in so that I can go over them with you and we can make sure that what you're taking is reflective of what's in the charts. Many times patients will come in and say, hey, doc, it's in the chart, you got it. But guess what? You've gone to other doctors in the emergency room and this or that, or grandma forgot to put something down 3 years ago, and the nice little medical assistant says, hey, is it all the same? And some misinformation gets transferred visit after visit after visit. So at least on that annual exam, bring in the medications so that, what you are taking is actually what is reflected and can be addressed. Now, some of you who have been to the doctors in the past few years may have heard terminologies like, "Hey, but it's on my chart." I saw my sister's my chart. Well, my chart is a product that a lot of large hospital systems and even some doctors use as your medical portal. If you have access to a my chart, I highly encourage, once again, like it or not, that you get familiar with it, because these days that is becoming more the trend of how to store and communicate your medical records. And they really are now putting that onus more on the patient than on doctor to doctor as it was previously. And lots of things will be coming to you from your MyChart or from your doctor or from their staff via email or text messaging. So we do have to get familiar with some of these more modern ways of communicating our health, considerations. Next slide. Okay, so let's talk about where we've been and where we are now. I always like to point out that things are improving. You know, like sometimes it seems like from day to day, year to year, voting cycle to voting cycle, are things really even changing? And I put up some data here from 1970 to 2020 just to show you that, you know, our life expectancy, these are the reported life expectancies for those years, have changed. If you see there on the left, it shows that back in 1970, doesn't seem like that long ago, maybe for some of us. Uh, the average expectancy of life of a Black man was only 60 years old. These days, a 60-year-old Black man just seems like a kid, right? You know, like if someone passed away at 60 years old, you say, "Oh my God, they left here too soon," you know. And to see now in 2020 that the life expectancy for Black men is 72 years old. And I would like to put an asterisk by that to also say that, you know, that data is probably even outdated, is probably even higher today. And you're also going to see higher numbers in the communities that are probably more affluent, more educated, in those expectancies being even higher. But nonetheless, we have improved in our life expectancy. It's wonderful to see that even in 2020, women, our average life expectancy has now exceeded 80 years old. And that's the average, you know, and what I see in my own practice is much, much higher than even these numbers. Next slide. Okay, and well, let's talk about what makes us go away sooner than we want to go away. Well, in all cases, men, women, all races, Black, you know, we see that heart disease and cancer are topping the list of, you know, what people pass away from the most. So that goes back to like knowing those cholesterol numbers, knowing that hemoglobin A1C. These are some of your predominant risk factors for heart disease. And then cancer, certainly we want to try to prevent cancer as best as we can, and we want to detect cancer as early as we can. Next slide. So when we talk about detecting cancer, and this is us going to see our doctor once a year in case we don't want to remember all of this stuff ourselves, that's what you pay us for, is that we want to start getting our screenings. And these are just some highlights of some of the more updated screening recommendations. So for breast cancer, I hope all of us women, especially Black women, are starting to get their mammograms by no later than age 40, and that is every year. Okay. And where it says stop there at age 65, I would put an asterisk by that because if you really look at the details of most data, that's also based off a discussion with you and your doctor. Because if you're thriving at age 75, in my own practice, I continue those breast cancer screenings to longer than that age, depending on how well the person is doing overall. Similarly, alert, alert, alert. Colon cancer screening starts at age 45. So all of you that last week thought it was 50, nope, it's age 45. So if you were waiting around to get to be 50, you're already 5 years too late. And for prostate cancer, you know, you want to start at age 40, especially in the Black male community. You know, many of you may have heard that this guy we once heard of named O.J. Simpson just passed away a few days ago, and he passed away from prostate cancer. And that's just one example of how prevalent and predominant prostate cancer is in the Black male community. There's some new changes with cervical cancer screening. Now it starts at age 25, so that's a bit later than we thought it was previously. So those of you still working on like 21 or 18, that's outdated. Now we don't have to start our cervical cancer screening until age 25. And we actually can stop that earlier. We can stop that at 65. Lung cancer, we don't screen everyone for lung cancer. We do, however, recommend screenings for our smokers. Next slide. So those are ways we can stay healthy from the inside. Now let's talk a little bit about ways we want to feel good from the outside. Next slide. Many of us, I hope, recognize this wonderfully gorgeous, spirited and looking young lady, especially some of our male viewers. Her name is Miss Halle Berry. And I wrote the word still because she was once upon a time synonymous with beauty, not just in the Black community, but in the world over. And she still is. Next slide. This slide here, You will see it's a slide with a lot of different pictures. I don't expect you to zoom in and look at all of those different pictures that'll be coming up shortly that says Zoom Boomers. And if you aren't seeing that, it's just to let you know that right now there's a trend going on called Zoom Boomers. And what that means is that in the past few years with the COVID pandemic, the world has shifted as we are doing today, where we're doing a lot of things via Zoom as opposed to in person. But people are now on Zoom recognizing that when their close-ups are zoomed in, that they have blemishes or that they don't look as spry as they would like to have looked and stuff. So people, when they get off their Zoom camera, are running into their doctor's offices and other places to say, hey, you need to make me look a little bit better by the time I do that next Zoom call. Okay, so this is a whole phenom that everyone is trying to look better because of the Zoom effect, because we are recognizing, it's like looking in the mirror, but looking in the mirror in a public setting. Go ahead to the next slide. Okay. And just to, this value, if you see the slide here, I wrote the money spent on treatments to look younger. Now, we can play with this statistic in many different ways. And if you see here, I have written 10 billion, but that is a very, very small estimate of really what this market is. This market is actually in the triple digits of billions in terms of what is spent on skin treatment. So depending on how you couch the search, but 10 billion is on the shy end. And just to go into that a little bit more deeply, how much are people spending on trying to look younger? Well, even just to put in $500 a year, you see back in 2000, 20% of people, over 50, that's quite a large number. That's one fifth of persons over 50 were already spending over $500 a year, on things to make themselves look younger. And now in 2022, you see that number is approaching 50% of people are spending over $500 a year. Now, people fuss and grumble at my medical practice because of the parking that they may pay $10 to $15 to come for their medical appointments, which may be to discuss their heart or their cancer or any other number of things to help them stay healthy or alive. But we are spending over $500 a year on ways to look younger if we want to kind of, gauge where person's mindsets are, but that's not exactly unwarranted, because feeling good on the outside does have positive benefits in how we feel overall. Let's go ahead to the next slide. Okay. So as I just mentioned, when we look good, we do feel good, and there's been data over and over for over the years that when people get their smiles fixed with their dentist and stuff, that they start to feel more confident and they start to become more social, and those social interactions bring them, it helps raise the endorphins. It just helps improve their overall health. So something as simple as fixing your smile actually makes you healthier, and that can be extrapolated upon in many, many different ways. And certainly we know that exercise is good for our health. Exercise is good for our heart. Exercise reduces the all-cause mortality. Exercise reduces the risk of cancer. But exercise makes us look good too. So, regular exercise, is also good for helping us to age well, both inside and outside. And, I don't know what type of audience, hopefully it's not a G audience that we're talking to mostly, but, I was going to put up a slide of a young lady that's no longer with us, also named Suzanne Summers. And, Suzanne Summers was famous for the show Three's Company, but, she also was a workout queen and had videos on exercise and stuff. But as she got older, she publicly said that the true key to good health was to have sex, and that she made a point of having sex every day for her health. So I don't know if any of us can keep up, to that standard. But, regular sexual health is definitely recommended as well. And I say this to patients in my practice, and some patients will say, well, I'm single, I'm not in a relationship. And once again, I don't know the audience we're talking to, but sex does not have to be with another person. So, we can also, enjoy sexual relations with ourselves, but there's also this thing, if you don't use it, you lose it. Well, that is true, because we have certain hormones in our bodies and stuff that are only excreted during the experience of sexual pleasure, and those things actually have positive physical, impacts on our overall health. Um, Down here, it is Sunday, and we talk about fellowship. Fellowship could be in the form of religion, it can be in the form of hanging out, it can be in the form of calling a friend, a neighbor, but having relationships with other persons. And it's important to highlight this at this time, because we are living in an age where, with the pandemic and Zoom and social media and stuff, that we forget to have human to human contact and interactions and stuff. And it's important to try to reincorporate, if we have not been, or to continue to incorporate, those types of experiences for us, because those things help keep us healthy as well as keep us young. Um, and then we'll talk more about, how we can do some things, some fun, cool things to, augment the aging process by working on our skin and our body, such as skin care and body care, body contouring. If you haven't started hearing these terms float around in your, circles that you run in. Next slide. Okay. So I put some names in here. My son's gonna kill me, but here, this slide is kind of busy, but it talks about skin. So one of the first things, with our skin, and once again, if we looked at the numbers of what people spend on skin products, the numbers are in the triple digits in terms of billions. But a basic good skincare routine with cleaning your skin and moisturizing your skin. I'm sexist, I admit, but sometimes I have to remind my male folk that, using a daily moisturizer is actually not just good for how they look and how their skin feels, but it makes it more resilient as well. And I put up your example, Gage and Jacob. This is my son and friend's grandson, and they're two teenage boys. One's on a basketball team and one's on a football team. And I'm talking to a friend, and she's telling me the story about how she's fussing at her grandson, Gage, a high school football player, to take out the trash, and he was not. He's a teenage boy. So she goes into his room to expect he's in there on his video game. And no, turned out he was in there with his face mask, saying that he was working on his on his facial routine, and that he'd get to the trash when he was done. And my son Jacob just got his own little bank account card or something, and the first thing I see purchased in the mail that he's purchased for himself is some things to prevent wrinkles in his eyes, so that when he gets his new contacts, he won't have dark circles under his eyes. So, we joke, but this trend of wanting to look healthy and stay young has, expanded into every arena that we can imagine. And including our washing and our moisturizer, we want to remember sunscreen SPF 50 or greater. And I like to remind our persons of color that includes us too, because we sometimes don't use sunscreen if we don't feel sunburn, so we don't think we need it, but we are still susceptible to the negative impacts of UV rays. So even if we're darker skinned and we may not feel sunburn, we too should be using a daily sunscreen. My next line down there, I have the poor plastic surgeons. And what I mean by that is that, in this day and age, people are acquiring treatments for their skin and their wrinkles all over the place. So now you don't necessarily have to run to the plastic surgeon to have facelift, right? You can get treatments in a variety of different medical settings. I get my face treatment stuff at my ophthalmologist. Believe it or not, a lot of the gynecologists are in the skin game. So you go for your pap and you get your face tuned up while you're there too. So you do see a lot of opportunities to, to work on your appearance in a myriad of different settings that don't have to be necessarily at the high price point of, surgical procedures with our plastic surgeons. Uh, and some of those treatments include, things like PRP, which has been around for some time. PRP stands for platelet-rich plasma. So that's where we take your own blood and its healing and regenerative factors, and we put it back into your own body in a variety of different treatment ways to help. But wrinkles is just one of those things. And most persons have heard of Botox. Botox is like saying Xerox. It's the most common brand of neurotoxin, but there are competitors to Botox injections as well. And fillers, people want their lips plumped up or want some sunken, cheeks filled out. So that too is has been being used widespread and is becoming more and more commonplace across the races and the ages and the sexes. Microneedling has been around for some time, and it can be used alone or in combination with your blood, like the PRP, in combination with laser devices such as radio frequency that I have listed there. And I don't know if that link will come out if you copied it, but it was an article just giving you more detail on what radio frequency or RF is. But I can also, if time permits, talk to you a little bit about it. But I'll group radio frequency kind of in the category of laser treatments. And these laser radio frequency treatments, as I mentioned previously, are available very widespread now, and not just at some of your higher end specialist office, but I offer them at my own office, and so do several of my colleagues across the city. And the good thing is that, these are not cookie cutter approaches. People can mix it up based off of how soon they want to expect results, what they want to expect exactly, the downtime, etc. So it really can be tailored to an individual's desire and need. Next slide. And as well as your skin, in your body, some of us want to, also look good from the from the neck down. And I put up here, fake it till you make it. So we've been doing that since the beginning of time, right? So even as far back as the in the Renaissance and the royal days, ladies were wearing corsets, and in the early 1900s and 20th century, women, became popularized wearing girdles. Yes, my kids now what a girdle is, they'll have no idea what I'm talking about, but in the new millennium, the latter part of the 20th century, women tossed their girdles and they started wearing Spanx. And these days it's not just Spanx for women, but there's Spanx for women and men. Next slide. But these days, people are even ditching external garments altogether because they want to wear their swimsuits and they want to be out and about, and they're doing these body contouring treatments. So some of these treatments can be done in conjunction, once again, as I mentioned, with like PRP or alone. You may have heard of like Cool Sculpt, which uses a very cold temperature to augment the fat or the muscles, but they could do it with warm temperatures. There's things that target at the skin layer or at the fat layer or at the muscle layer or at maybe different combinations depending on which device or devices you're using. And these are typically laser or radio frequency type devices. Next slide. Um, And just, quickly, just to note that these bodies, what's beneficial about these new body sculpting treatments is that there's no downtime, and you can go in, you can have a treatment done, for lunch, and you can go back home, and or go out to dinner that night and not have to, escape from people for days or weeks at a time as you recover. Next slide. Once again, you can mix things up. Radio frequency, it may sound scary to some persons, but it is one of my favorite things that has come about. And for the doctors on the call, I'm really excited because I've had my radio frequency device now about 5 years for the purpose of aesthetic treatments. But as I continue to go to more and more lectures and conferences, we're really realizing the utility of radio frequency, not just in the aesthetic realm, but also in the medical treatment realm. So now we're able to treat back pain and some eye injuries and some of these other things simultaneously or with the same devices using radio frequency. And radio frequency is wonderful because it's very user friendly. The device that I use in my office, Temp Sure, is highly, the device itself cannot allow you to burn people or to overtreat people. And it is using the person's own body, because what it does is stimulating, their collagen and elastin to produce in their own body without giving them something external. So I really love radio frequency and all the different modalities and opportunities we can use with those types of devices. Next slide. Okay. And this is too busy for you to read, but it just basically says, how do you know which device is best for you? Everybody kind of, once again, goes to Google, and it's, and there's a lot of different ones out there. There's different new ones that come out every day. If you talk to your provider or whomever's you're looking to have do this for you, make sure that, you get a good sense that there's someone that you can trust that is not just telling you what they offer, but also telling you what technology is out there that's available in what combination of things. And as I mentioned, the things you want to look at is, well, how much does it cost, or how long am I going to be down, or how often do I have to do it, or how fast is this going to work? And beware if people are trying to sell you pie in the sky. If you're morbidly obese, a radio frequency device for fat treatment is not going to be effective in giving you the same thing as a actual liposuction or actual surgical weight loss. So there are instances where we have to be realistic in our expectations about what we want from these different treatments. Next slide. This is once again just some of the common names of some of the ones that you'll see out there. I have Temp Sure. There's one called, I guess, Picture. One for the muscle that's very popular is InSculpt, for folks looking at what is a muscle laser device does. Well, one treatment is like doing 20,000 crunches. So anyone let me know, call me the last time you've done 20,000 crunches in one setting, and I'd love to meet you. But that's what you're buying, is the ability to do 20,000 crunches in 1 hour from a device that is relatively safe. Or not relatively it is safe. Actually, I've tried it in conferences myself. It's pretty cool. Next slide. And this is just some attestments from the doctors that do these things. Next slide. This sounds scary. We'd love to talk about this Halloween vampire facials. Kim Kardashian, if any of you have ever heard of her, was popularized some years ago, being on TV, getting her vampire facial. And that's where we take the PRP blood from your body and we put it back onto your face, and then we do the micro needling. So, that's why it's the vampires from blood. And then, but at the end of it, you come out with a rich glow, a rejuvenated skin surface, reduced wrinkles. And not only is it good at the moment that you're doing it, but it's the gift that keeps on giving. So over the next 2 to 6 weeks, your skin just gets better and better and better. So, in case you've ever heard of what a vampire facial is, and those things you can find around, like I do them at my office, but they're pretty fun and cool to see what your own body can do for itself. Next slide. Every day there's something new. I love this new addition that we can do now. It's called a PRP butt lift. I had a young lady a couple of months ago that was flying to Florida to get the Brazilian butt lift, and she was explaining to me how she paid the airline to help her fly back on her knees and have her butt in the air and all these types of things to get a butt lift surgically. Well, a PRP butt lift is where we inject your blood obtained from a PRP into target areas that we want to kind of lift and kind of mold for you. And then we can use our radio frequency device to help stimulate your elastin and collagen in those areas. And you don't even have to fly to Florida to get that done. Next slide. Okay. Mona Lisa, I'm just naming out a few things in case that you've heard of these in like common talk of, in your social circles. Mona Lisa is a type of laser treatment that ladies can get to restore their vaginal tissue, and some women are doing this for cosmetic reasons. Some women are doing it for incontinence. Some women are doing it to restore sexual pleasure. Some people are doing it to, decrease a condition called atrophic vaginosis. So it has both medical and cosmetic benefits, many medical ones that are quite beneficial. So a lot of ladies suffer in silence with these conditions because they don't think there's anything that can be done to help them. And now we know there are. Mona Lisa is just one example. Next slide. There are cool new options for doing like in-office liposuction. You can have fat taken out of one part of your body and put it in other parts. You could have it taken out of your butt and put in your lips, and you can do a lot of these things in 1 or 2 office sessions. That's not actually surgery. So if you're interested in those types of things, they are out there as well. Next slide. And pellets have been around for some time. A lot of my colleagues here in the area have been doing pellets for women, and that's where they take some of the vital sex hormones like testosterone, estrogen, and progesterone in both women and men, because women do have a need for some testosterone as well. And they put it in a little pellet, sort of like a piece of hamster food, or it looks like a piece of hamster food, and they implant it just under the skin there, and it slowly absorbs over time to provide those therapies for you. I was very happy to see the past year or two that now they've expanded pellets to be used more widespread in men as well. So I have men colleagues and men patients and stuff that are also getting pellet therapies, and it helps them feel overall more healthful. It helps their sex drive, it helps their muscle tone, it helps their memory, it helps their sleep. So these things are not limited to just, in persons like, well, my sex drive is great, I don't need those things, but it really helps from a very holistic standpoint of view. Next slide. A thread lift, I'm just like I said, rather not new things that you may have heard of, but thread lift is pretty cool. It looks like where you take fishing wire and they thread it in parts of your jaw or your lip, and what it does is it creates it makes the body think there's trauma there, so it actually helps to build up those areas. So you can if you wanted a more square jaw, it can do that within several weeks, or if you wanted your lips to look a little bit more pouty for an event, it can do that too. And the thread dissolves on its own, and very little or no complications have been reported with these types of treatments. So very good alternative to getting a surgical facelift. Next slide. And so I did a lot of talking. I do thank you and appreciate you. This is my information. I'm Dr. Adrienne Burroughs, and this is my website and my office number and email. And I wanted to just kind of give an opportunity to really have more of an interactive discussion with any persons that have any questions or would like to talk more.
Dr. Burroughs, this was absolutely great, fascinating. And I'm glad I don't have to go all the way to Brazil.
You're right, you don't.
No, thank you so much again. Let's open the floor for questions. Dr. Walks and Dr. Hines, we have any discussion on this? I thought this was so fascinating. And I'm not going to Brazil. I cancel my trip.
Dr. Maxey, absolutely, it's fascinating. We have several
comments in the chat regarding some of the more recent ones regarding the recommendations for immune system support, recommendations for sunscreen, some questions about diet, just overall additional factors that can help with health.
Excellent. Dr. Hines, do you want to address some of the concerns?
Well, Dr. Lawson has his hand up. We want to get to him first.
Okay, Dr. Lawson?
Well, two things. One is that I've seen a lot about Black folks are more subject to what we call weathering, aging more quickly. But yet at the same time, I've seen some data suggesting that, especially for our skin, that we may age more slowly because of more tolerant towards sunlight. And one of you comment on that. And also talk
That
about
mean if you're
aging.
Black, you don't crack?
That's right. And also when aging is presented as if it's a longitudinal, a linear process, but it seems as if there's some groups that are just more susceptible to aging than others. And so some of our super elderly do very well, some of our early ones don't do very well, and then the middle don't do so well. So I appreciate any comments about that.
One of the things that I read some time ago, that Black folks, African Americans, die earlier, but those who live past age 75 are the longest lived people in America. But you got to meet that first cutoff.
Those who live past 75 are what?
They are the longest lived in America.
Right.
Those that meet the cutoff, when they get past 70, they tend to be longer lived than anybody else. But so many people get cut off well before that. That's the problem.
Yeah.
Well, let me just jump in on the good Black don't crack crack that you made, Dr. Maxey. We all need to protect our skin. So even if we are whether we are butterscotch brown or deep dark chocolate, we still need to make sure that we use our sunscreen and protect our skin.
I'll just piggyback on that too, because there's a question in the chat about, sunscreen, and not only should we all be using sunscreen, but also start demonstrating that to your kids and your grandkids as far as, all that time that you want them to go outside and play, right? They should be using sunscreen on a regular basis. And even your young people aren't, they can also get the facial lotions and the facial moisturizers that have the SPF stuff, already built in. But establishing those habits early can be very beneficial.
But at the same time, I want to emphasize that sunshine and vitamin D are very important to prostate cancer and longevity in general. So.
Oh, 100%. Like, I absolutely support going outside, right? Like, and getting that. There's a reason, right, for all that outside time. It's healthy for you, just for all the reasons that you just said. But there's also, because here's the other thing that we also have to acknowledge, right? Things have changed in the atmosphere, ozone layer, all that kind of thing. So, and then especially too, when you travel, when we're traveling to some of these tropical places, there's this tendency for Black people to go, oh yeah, no, we don't get sunburn, we don't need sunscreen. Yes, you do. Yes, you do. So just wanted to put that out there. And then there's some things about which SPF. Well, easily found on Google. You can find the different SPF strengths and things like that.
What does SPF mean? Let's define it for us.
I defer. What is the fundamental definition of SPF? But it translates to kind of the amount of protective components in your sunscreen, but I don't know what it actually stands for.
Okay.
I'll look it up and put it in the chat for you once I finish talking, because I can't that much.
So let me just follow up a little bit on the whole thing about being outside. We do tend to think that folks of color, particularly folks who are darker skin than others don't need protection from the sun. And at the same time, we do need to be out in the sun. We do need to get that vitamin D. You know, a lot of folks say that. I don't know anybody who knows whether they're vitamin D deficient or not. There's it's something that we need to find out. It's one of those things where when we say know your numbers, there are a lot of numbers we should know. There are a lot of things we should know. For example, how much time should I spend in the sun? And sunny days versus cloudy days. If I'm going someplace where there's a lot of reflective light, if I'm someplace on the beach where the sand is going to be reflecting, there's a lot. I had an experience of thinking that because I'm a nice healthy shade, I can go out and lay in the sun. That was not a good experience for me. I got actually very sick and had a case of sunstroke. I now have learned that I am not chocolate enough. I don't think any of us are to go lay out in the sun for several hours. So we just need to understand that there aren't really simple answers for everything. You know, go in the sun a lot, use sunscreen. All of those are important, but understand more. As we have now from Dr. Hines, SPF, sun protection factor. Okay, that's what it means. Uh, I use SPF 60 when I go out. Is that good? Should I be using 40? Well, I'm not trying to get a tan, so 60 works for me.
And one other thing that we remember some of the talks we've had by Dr. Brian Stone. One of the reasons that was given for African Americans having a higher rate of prostate cancer is the fact that the melanin in the skin does block some of the vitamin D formation in the skin, which is done. So it's a question of a happy balance between exposure and non-exposure that should be done. Maybe we'll get him to come back on and talk a little about the relationship between the manufacture of vitamin D by sunlight and the contradiction in that and SPS. So that's something we should come on further. Any other comments in the chat noted?
There's two more. One of them is around should patients choose their primary care provider by discipline? And my interpretation of that question is, should you choose a primary care provider that has a special interest or philosophy or that is important to you? And I would go with absolutely 100% yes, if that's the question. Here's what I mean by that. We talk a lot of times on this program. Dr. Sherrod will come on and speak about some of the alternative options that are available to patients for different types of conditions. If those things are important to you, you should absolutely pick a primary care provider who believes in things that are important to you, right? There are a lot of ways to be right. One of the reasons we speak to the art of medicine is because there are many ways to get a patient to a goal. So you should absolutely look for a primary care provider who maybe has special interests in topics that are of interest to you. If obesity medicine is important to you, if aesthetic medicine is important to you, you can find a primary care provider who can treat those needs for you, as well as some of the other things that may not be as important to you specifically, but might be important to your primary care provider for your longevity. So yes, and it's assuming you live in an area that has those kinds of options. And because let's just acknowledge everybody doesn't have those options available to you. But if those options are available, yes, you should choose a primary care provider that is in line with your belief system. And then there's another one about how important is nutrition. The importance of nutrition is increasingly becoming a focus area of research and study. It has been for some time, but it's getting a lot more press lately. There's actually a conference going on in DC around food as medicine. that's happening this summer, and it's sponsored by various government entities. So there is a tremendous importance to the role of nutrition as far as your overall health is concerned. And just like many of the other things that we've discussed on this program, there is not one particular diet that is best for us all, right? Sometimes you may have to try and see how you as an individual respond to a pescatarian diet, a vegan diet, a sugar-free diet, a gluten-free diet, fasting. That one's the thing that's, in all the rage now, right? Intermittent fasting's all the rage now. How do you as an individual respond to those things? But nutrition is critical, because what you're intaking, of course, it's going to have an impact on your body. Of course, it's going to have an impact on your health. The other thing that's going on is a big talking point now is the ultra-processed foods. And that's a doozy, right? Because ultra-processed foods includes things that you should probably avoid. Okay, fine, potato chips, right? But what about pasta? What about bread? Like, those are also ultra-processed. What to do with some of those things? So absolutely, nutrition is important.
Well, thank you so much. We're at the top of the hour, a little bit past. So why don't we, if there are no other comments in the chat, why don't we have final comments? We'll start with you, Dr. Hines.
I've spoken a lot, but I learned some things in the talk about some of the options to make you feel better about being you. So it's always important to feel good about yourself, and think about how you can make the things better that you don't like.
Well, thank you so much, Dr. Walks.
Thank you, Dr. Maxey. Since two of my favorite psychiatrists, Dr. Bailey and Dr. Lawson, are on today, I think one of the things that we need to emphasize more is the addressing and normalization of mental health concerns. Just about every single thing that we can face in our life can impact us psychologically and impact our mental health. And from a primary care and general health perspective, pretty easy nowadays for doctors to ask some questions about how someone feels from a psychological perspective. Ask them what's going on in their life. Just enough to let them know that you as the doctor want to know what's happening and want to know if something is bothering them, want to know how they're sleeping, want to know if their appetite is changing. Because these things will absolutely impact the general healthcare things like the diabetes and the hypertension and everything else that someone may be coming to see you. So I think that as we push into further along with this whole body approach to things, I think we need to push further along with fully integrating caring for folks, to include those questions, those screening questions, and sometimes a little bit deeper questions about what's happening in your life and how is it impacting you.
Well, since you missed him, is Dr. Bailey unmuted to make a brief comment? He's going to be coming up soon in our series, I think. Dr. Bailey?
I see Dr. Bailey. If we
I'm
can
unmuted now.
go.
I thank you guys very, very much. I could not say it better than Ivan Walk stated it. I think that was an outstanding point. So really enjoyed the show today. I think Bill Lawson's comment in the chat is also timely. Chronic depression causes persons many difficulties, including aging faster. I think your experts' comments today were apropos in issues that, as Ivan Walk pointed out, clearly require us to pay attention to our mental health proactively in advance of having a difficulty, like a diagnosis of major depression or generalized anxiety disorder, all issues that get worse than I think our aging, but also I think our physical skin presentation. Thank you so much for inviting me today. I appreciate it.
Dr. Bailey, would you comment? You're involved in a big project with prison health, I know, right now.
Absolutely. In fact, I'm literally in the car rushing back to New Orleans as we speak, so I'm actually on the phone. Very happy to say that I love to come on your show with him and talk about it. And I give a tremendous credit to Randall Maxey. He's absolutely the individual who pushed me in this direction 4 or 5 years ago. We talked about it. But very proud to say that at the LSU School of Medicine, New Orleans, in December 23, we were awarded this opportunity to provide prison health care, comprehensive mental health, with all of the physical concerns as well. But the mental health piece is most important because they've actually been under consent decree, i.e., conservatorship by the federal government for 8 years due to poor care in those settings.
Wow.
We start tomorrow morning. We're excited about it. We spent 6 months preparing to get ready. And the reality is, by far, New Orleans, Louisiana, like most big cities, LA out there in California, Rikers in New York, Chicago, the large inner city jail is the largest inpatient-oriented psychiatric hospital in most all of the states. And disproportionately, that's exactly where you find most of the individuals with chronic and severe mental illness type problems. And that's where you also find individuals very often who have many of the physical maladies that lead to early mortality and unwarranted death, especially in minority communities. So we've got a lot to do, a huge role to play, and a big responsibility, I think, to find every avenue we can as African American doctors to improve the lives of Black people. And this is certainly one strategy I think we should pursue. Looking forward to it. It should be a 5-year contract. I'd love to come back on and talk about it more at length at some point, Dr. Maxey and Dr. Walters.
And thank you so much. I wish to remind everybody that one of our iconic medical advisors, Dr. Wilbert Jordan, always said, everybody should have a primary care physician.
Yeah.
And we do know that when your primary care physician cares about you and your life, that's always the best person. Thank you, everybody. Enjoy your Sunday. Have a great day. Thank you.
Good day, everyone.
Thank you, Simon.